Okay, so here's your guide from the Centers for Medicare and Medicaid Services, which is the government's official guide for how to select a Medicare insurance policy. So let's use some of this guide. We'll kind of skim through the basics and then we'll get into the good stuff about exactly what you need to do to get the right Medicare supplement for you. So I think you'll find it's pretty easy once you determine what your current options are. So here's one option. When you turn 65 or you retire from work, you can then go and apply for Medicare A and B. A is free because you paid for it your whole life, and B is the part that you have to pay for. In 2025, the base rate for Part B is $185. It can go much higher than that if you have a higher income. So Part A, it's going to take care of your inpatient stay in a hospital, your skilled nursing facility up to 100 days maximum, hospice, and some home health care. So think of A as the room and the board. It's the building and the bed. Part B, medical, is everything else. So it's all the hands-on supplies and services that you get from your doctors and other healthcare providers. And it doesn't matter if you're getting this services as an outpatient or if a doctor came to your home. Part B also includes all your durable medical equipment and preventative services, like those famous vaccines that I will never get. Part D, drugs. Prior to 2006, some Medicare supplements actually had the Part D coverage built into it, but now, after Part D was created, Part D is separate. Okay, so plans that offer drug coverage are run by private companies that follow the rules set by Medicare. So I'll show you in a few minutes how I use software to select plans for folks, including Part D. Okay, so you have two Medicare options, basically, right? There's really a third, which is retiree coverage, which means your employer could offer to continue to offer benefits to you into your retirement. So on the left is what's called original Medicare. That simply means that Part A and B is your primary coverage. And you can add a separate Part D drug program. This to me is nice because if you wanted to change your Part D program each year, you have the opportunity to do that. You don't have to, but you can select a different Part D program without affecting your hospital doctor coverage because it's separate over on this side. Most folks will add a supplemental coverage or Medigap, right? Medicare Supplement or Medigap. Or as it says here, you can use coverage from a former employer or union. I just met with somebody who works for Baltimore County, and they gave me the printout that is provided by Baltimore County government. And man, you can absolutely get ripped off there if you don't know what you're talking about. So when you see me posting about that video, that's going to be next. We're going to walk through the Baltimore County offerings, and I'll show you how it's actually more expensive even after the subsidy that they give you than going out onto the open market. Anyway, so you have original Medicare on the left. On the other side, you have Medicare Advantage. I like to call it Medicare Disadvantage, also known as Part C. It used to be called Part C. But you see, the government is trying to push the Medicare Advantage over the original Medicare side. Why? Well, that's because on the original Medicare side, guess who pays first? Medicare. On Medicare Advantage side, guess who pays? Not Medicare at all. They don't pay at all. Well, they pay once, okay? And it's a fixed amount per person for every person that signs up for a Medicare Advantage plan. So you pay Medicare Part B on either side. Either way, you got to pay. It's $185 on up. And actually, it can be less if you have really low income. Not getting into that here. So Part B is the part you pay for. But what happens is on the Advantage side is Medicare says, hey, we're going to pay the Advantage company, the private Advantage company, a set amount per person. And then we're out. Don't bill us anymore. So on the right-hand side, this is why I call it a disadvantage, because you're paying for Medicare because you have to in order to get an Advantage plan, but you're not using it at all. You're not using Medicare at all. You're using whatever benefits the private company is offering. And these are the kind you see a lot of TV commercials, especially during the end of the year, where they say, it sort of sounds like, hey, it's zero, pay zero, and check your zip code. Make sure you get the benefits you deserve. Folks, if you're getting your news and information from the television, I like to call that the lie box, because let me tell you something. The television is not looking out for your best interest. If you are the kind of person that calls the television 800 number after seeing an ad, please do not call me. That thinking is not in line with the kind of folks I want to help. All right? So, especially when you can get free help, not free, but you can get, it's free to you, free help from people like me, because the insurance companies factor in my compensation into the Medicare supplement premiums already. So it's kind of silly to not use that professional advice when you can at no extra cost to you. But okay, I digress. So on the right-hand side, you still have to have A and B. Medicare pays the Advantage company so that Medicare can limit their expenses. Okay, but in exchange, you may have higher out-of-pocket costs than original Medicare. You also may have an additional premium if that Medicare subsidy that's getting paid from Medicare to the Advantage plan isn't high enough to cover the actual premium. So there is premium on this plan. On these plans, it's just who's paying that premium. Now, the TV commercials will sound like, hey, we give you dental and vision, and, we'll come and clean your house and wash your car, right? And make your meals and things. So I'm sort of joking, but this is what you hear on the TV, and it makes it sound like the greatest thing since sliced bread. Well, ask somebody who's been on it for this kind of plan for 6 months and then needs to get some services. You need to get some care. Well, see, this side keeps costs low. It's like an HMO, PPO, because they're rationing your health care. It's controlling how you get your health care. For example, I've been on Adderall for a decade and a half, maybe more, Ritalin before that, because I said I have ADHD. I'm like, okay, well, this is when I kind of like listen to doctors. And I said, okay, cool. So I've been on it for a really long time. It helps in a lot of ways. Back in December, the doctor I was, dealing with, she says, the state says your dose of Adderall is too high. So, okay. I don't know about you, but I am not a big fan of the state telling my doctor how to treat me. So if you want somebody else to be in control of your health care, then go ahead and get a Medicare Advantage. They pay me green money. If you want to sign up for that, I'm not going to fight you. But I will for a little bit, because I know how the story ends. So for me, Medicare Advantage, it fits in between where you either can't afford any coverage at all and you would just be left with plain old Medicare, and that means a lot of stuff will be left on you. Or, there goes the ADHD. Where'd my thought go? That'll come back to me. I apologize. But yeah, basically, you're going to have more controlled. You have the control if you're on the original Medicare side, right? Because as long as the service that you receive from the doctor is approved, well, you're not controlled by where you can go, like on the right-hand side. Because over here, you may need to get approval before it covers certain drugs or services. Well, on the left, you can go anywhere you want in the U.S. that takes Medicare, which almost all of them do. So left side, you have when you get the supplement insurance, we'll get into that in a second, but you have no copays, no referrals, no networks, and they can't drop you a supplement company on the left side, right? On the right side, these are annual contracts between the Medicare Advantage company and the Medicare and Medicare. So there's many examples. Like Johns Hopkins had their own Medicare Advantage plan a few years ago here, and I had people that they get a letter. You get your annual notice of change letter, and at the end of September, this is when all of you are asleep about Medicare because you're out on the beach. Makes sense. But in that letter, it says, hey, P.S., but at December 31st, your coverage is ending because we're not offering it here anymore. Why? Why do they do that? Well, it's because they're not making enough money. So the TV tells you it's all about giving quality health care and how much we care about you and bringing the human into health care and all this nonsense lies, horse poop. Sorry, I'm a straight shooter, so I'm not sorry. That's exactly how it is. They're lying to you on the TV to get you to sign up, and then when they don't make enough money, they kick you to the curb. Welcome to Medicare Advantage. But all the commercials, or a lot of them, and the books and the government books, they're all want to get you over there subtly and not so subtly. So it'll say plans may offer extra benefits that original Medicare doesn't cover. Okay, let's say you go the Advantage side. You're paying zero premium. What kind of dental insurance you think you're going to get for zero? You think you're going to get the top of the line, it covers everything deal, as if you just went on and bought it on your own? Nope. So these are sort of a pain because you really have to analyze every little tiny detail, and then you have to add all your doctors in. Because why? Because all of these have a network, and you're going to have to go to only where the network is, or you'll have to pay more, right? So you either have no coverage or pay more when you use an Advantage plan and go outside the network. Except for emergencies. They don't want you stuck in emergencies. Okay. Yeah, what else? Okay, most plans include your Part D. So your drug plan is built in with your health plan on this Part C Medicare Advantage side. That can be okay, but let's say your medicines change and you like your hospital doctor coverage, but your medicines change and now the prescription part is too much. Well, you can't change your Part D without changing your health plan now. So you're kind of back to square one. So for my money, you're going to do much better on original Medicare. Let Medicare pay to the fullest, and then get a supplement that will pick up the gaps. Now, I am speaking generally. If I get with you one-on-one, it's a whole different situation. I mean, not whole different, but we're going to take your particular details into consideration. Okay, so bottom of page 9, really, really important point here. I put it in yellow. Every Medigap policy. So we're talking about the supplemental policies that go along with the left side here, that cover the gaps that are left on you on the left side. Here's the main thing. Every policy must follow federal and state laws designed to protect you. All Medigap policies are standardized. This means policies with the same letter offer the same basic benefits no matter where you live or which insurance company you buy the policy from. Okay, and so there's 10 different supplements plans. We'll get into them in a second. But all of those plans are identical by law in every single state, unless you're in one of these weird ones, Massachusetts, Minnesota, and Wisconsin. Then they're just standardized slightly differently. But still, what you want to take away from this is a plan G is a plan G is a plan G. Doesn't matter which company's selling it. Doesn't matter if the girl or guy at the doctor's office, looks at your new card and goes, "Oh, we don't take Aetna." Love that one. Well, what do you mean you don't take Aetna Medicare Advantage plans, or you don't take the Aetna Plan G that you are required by law to take if you take Medicare? So look, just like you don't get your answers about insurance from the television, don't get it from the girl at the counter who's getting paid by the hour to check you into the doctor's office. Tell you what she's not doing. 20, 30, 40 hours a year on Medicare and all the rules about all the insurance. I guarantee it, because she's not getting paid to do that. So what you need to know is Plan G is Plan G is Plan G all across the board. That means you'll get the same benefits, but a lot of you are paying way more than you need to. All right, so I'll show you how to fix that problem in just a minute. So here we go. You have your standardized chart of the Medicare supplement plans. This is all the plans, A through N. See, the H, I, and J are gone. Okay, and you might notice here, this is actually the older chart before 2020. You see down here, Part B, deductible. If you look at the F and G, okay, identical, identical, identical. This check mark here means that it's a benefit that's included in the coverage of that plan, right? Check mark. Plan covers the benefit. X's plan doesn't cover it. So if G is the most popular, F and C are actually retired unless you got on Medicare before 2020. Why? It's because as of January 2020, Medicare new rule came out and said, hey, you people, like insurance companies, you can't offer any plans that pay for this Part B deductible for people. We want them to pay on their own. And this year it's like I think it's $257 this year. When I started back in 2004, it was $76, the Part B deductible. So you can see over 20 years, it's gone up from 76 to 257. Not terrible. Okay, but that's not the point. The point is F and G are identical in every single way except the Part B deductible. So Plan F pays it for you, Plan G does not. So even before 2006, when people said, I want the best plan, I want Plan F, I would talk them out of it, even though my compensation is based on a percentage of the premium that you pay, right? So if you're going to pay more premium, I'll get more money. So here's one way that you can get ripped off by the insurance agent without core values, right? Is that they're going to show you what they have to offer, not necessarily the best. So be careful on that one. But Plan G, what that would look like then is if you go into the hospital, well, there's a let me hold on. I'll show you a different page for this. But these are the supplements that you get to choose from, right? So A and B of Medicare is first. They leave you a bunch of stuff on you. That's what's listed on the left-hand side is the co-insurance and co-payments that Medicare does not cover. That's why you need a supplement plan to cover them. So if you have Plan G, for example, which is now the Cadillac of plans, because once F is not allowed to pay for that Part B deductible, the F and G are identical. And you don't need two of them with different numbers or different letters. So Part G is the Cadillac, and you're going to end up only paying the $257 deductible once per calendar year per person. And then for the rest of the year, anything that's Medicare approved is covered by Medicare and the supplemental plan. Again, no copays, no referrals, no networks. All right, so let me pause right there. Find a different let me find a different tool here for us. Let me get into my software over here. It takes me a minute to log in. My apologies. You can sit there and unpack all that information I just dumped on you real quick. All right, getting into my quoting tool, which compares all the Medicare supplements. All the Medicare supplements. All right, so let's see. Let me pull this back over here for just a second. so that I can make sure I don't have somebody's name pop up. All right, so let's just set up an example person here in the tool. I'm going to say, just gave this person the name Bob D. Into 1085, age 65. Let's say they're not a tobacco smoker. Bob is obviously male because there are two genders, male and female. Everything else is evil hooey. All right, let's say Bob wants to start his supplement on May 1st. We're going to show a plan G. We can quote the other ones too, and a lot of these companies will give a household discount based on whether you live with somebody or not who's 60 years or over for the last 12 months. That's called a household discount. There are other types of discounts as well. All right, so what I'm showing you right now, you will not see anything like this from someone who is not independent. Why? What do I mean by that? Well, if I work for a company that only offers that company's products, well, then I don't need to show you a list of everybody else's, right? As a matter of fact, I can't, because I only work for that one company and only offer what they have. And this is what happened with the Baltimore County thing that I looked at, right? It's, hey, look, I do a fair assessment because I'm a fiduciary financial advisor, which means when I do financial advising, I am obligated to put your interest above my own, which means if I could make more money by offering something over here, but this over here is better for you, I have to show you this that's better for you. Matter of fact, I just roll that way anyway. It makes life a lot easier. And since Jesus is, writes my rules, well, then it's pretty simple. But here's how it works. Everything on this page is Plan G for a 65-year-old male. You can see the premiums go from $140, let's call it, all the way down. You can see all the names here: Cigna, ARP, Mutual of Omaha, State Farm. So State Farm, they're known for what? Home and auto, right? So even though they've been in the market for 44 years, they can only eke out $176 worth of premium. You'd have to pay them for that, right? Why then would you do that when there's all these other options that are less expensive? Nothing wrong with State Farm. I'm sure they're great at homes and autos. And the Plan G is going to be exactly the same as your friend, right? But you're just going to pay a lot more if you want to get on that State Farm plan. Same thing here. Care First, big name big name, right? You hear Blue Cross, Blue Shield, Care First, $195 for the same exact plan by law. Globe, like, who's that? Medico, who's that? Right? Everybody and their uncle throws their hat in the ring because I think they say to themselves, well, hey, we got all these customers already for our homes and autos, so why don't we just add in some Medicare so we can not lose that business to somebody else? Makes sense for them, but if you make a mistake, you could be paying $520 instead of $150. You calculate that every month, and then what? Now, so if it depends on what's important to you. If you want to have the same plan as your friend, so when you go golfing and sit around the breakfast table, you can all say, oh, we all have AARP, for example, or whatever you have. Great. And you're all paying way too much, probably. So maybe not. And don't get me wrong. I represent AARP. I can help you with them. And if they come to the lowest price and that's what's most important, hey, great. By all means, sign on up. But not a big fan, especially when you can do something like ACE for the same amount of money. ACE is owned by Chubb Limited, A++ company, newer to the market, but I got about 30 people on this, and zero problems, $170, can't beat it, right? For how well they treat you. So, hey, you can sign up for any of these. You just have to understand that you might be locked in for life, depending on the rules, okay? Because when you first get on Medicare, you don't have to answer any health questions, right? You're guaranteed to get one of these plans. You just sign up and pay the company and you're covered. The end. But you go outside those open enrollment periods and now you don't have any special rules about the health. You're going to have to answer all the health questions. There's several pages. Some of them are what I call knockout questions, meaning if you say yes to this one, you are not eligible. That's where it ends. Okay, now there's this new birthday rule where, you're allowed to switch your supplement to another company within 30 days of your birthday. Hasn't been around long enough for me to like it. I've used it a couple times because people are really, really stuck. But a lot of these companies, they don't pay people like me at all. They pay you zero to help you with that birthday rule. As a matter of fact, I lose a ton of money by helping you with that birthday rule. A ton, in a lot of cases. So there might still be one or two companies that actually pay people like me to help you with that. But otherwise, I would just say stay put, because think about it. Under that birthday rule, what that says is, if you are not healthy enough, basically, right? If you're not healthy enough to be able to make a change to a different company, but by answering all the health questions, if you can't answer those health questions and can't pass underwriting, well, then you can switch to a different company and they have to take you. So all you business owners out there, I'm just trying to think of some kind of business analogy. Let's say a car place, right? Car repair shop. That's kind of like somebody making a rule that says, I can smash my car to pieces, and within 30 days of my birthday, you have to repair my car at no cost to me. Only you have to eat all the costs. So think about that. You go under this birthday rule, you move to a different company, and you're in a group with a whole bunch of unhealthy people with all kinds of problems. What do you think is going to happen to that premium over time? It's going to go up, because that's what these companies do, right? Mutual of Omaha, for example, they're all the same. They have a block of business, and they sign people up under that block of business, and then everybody gets older. And when we get older, we wear out and we get sick, and then we have to get care. And when we get care, we give them our Medicare supplement card, and the supplement pays out money. So if you have a whole group of people that are unhealthy, the company that's covering those folks is going to have to pay out a heck of a lot more. They're going to have to eat it. And if you're running that auto business, I bet you push back right fast, real quick on having to pay all the bills without taking it. You know what I mean? Like, you take all the risk. So I'm not sure what geniuses are making these rules, but I think their mission personally is to get control of the insurance business, and you're the one that has to pay the consequences. But I digress. So yeah, you can use the birthday rule and get yourself onto another supplement during that birthday, but you better be careful. And I've used it a few times because someone's premium might be $400 and some odd, and they've got all kinds of health problems and they're stuck. Well, if that's the case, then I can flip somebody over, get them a different lower cost plan. It's only $200. Okay, it's worth it, because you figure it's going to take a lot of time for these premiums to go from $200 to $400 where you are now. And in all that time, in the meantime, you could be saving money. Now, if you're at State Farm and you only have one option, or if you're looking at the Baltimore County government offering, well, first of all, they're not even offering supplements. They're offering surrounds and advantage plans, and they're going to cost more than you would pay over here. So I don't even know why anyone in their right mind thinks that's a good idea, but unfortunately, I met a lot of people who aren't in their right mind. So I guess it works for somebody. But here's the deal. So you just pick one and you sign up, right? And I can guide you towards which ones, because it's not always dollars and cents. I mean, look, $169, $169. Which one are you going to pick? Physicians or ACE, right? Or Mutual. They're all in the same ballpark. So that's where I can come in and add some extra insight on your specific situation. Okay, so now let's recap. So let's say you're getting ready to get on Medicare. you are, pardon me. Okay, just making sure I'm still recording. So let's say you're getting on Medicare pretty soon. Here's your costs: $185 for Part B every single month, regardless of what supplement. And if you're a 65-year-old male in, 21085 zip code, these are your choices. So call it 150, 160, 170. So what's that? Let's get out the old calculator. Make it simple. Let's call it 160. Whoops. Plus 185. So now you're at 345 a month. Just over 4K. All right. Now, let's say that you have some prescriptions. So let me pop into here, and actually let me turn this off for a second. Okay. I just want to pull up some contacts here. I might have them on the screen. Let me add a new contact. We'll just say Bob D. Must be 2 characters. Okay. Bob DOD. Let's put in zip code 21085. Maryland, Hartford. What else does it want here? Guess it wants a phone number. Something like that. Create contact. All right. So here we are on our made up profile. Now what I'm using right here, it's called Plan Enroll. See in the middle here, it says Get Synced. Enable two-way client record updating. So when you work with me, because I'm through Integrity, the largest distributor of life and health in the entire nation, the chairman of the board is Steve Young of the 49ers. Remember the quarterback? He's the chairman of the board of Integrity. Just, they're huge. The technology's awesome. One of the best pieces is this Plan Enroll two-way sync. So I could send an invite here, and then if Bob Dodd was real, what Bob could do is then accept that invite. And then if Bob goes into his health profile, or maybe he puts his age, let's make sure we pick gender. See how there's only 2, male, female? Gotta love that. Okay. Prescriptions, providers. We would only need to add providers if we were looking at Medicare Advantage plans. But whether Bob logged in on his end and added some prescriptions, or I add them on this end, either way, they're going to be held in this tool. So it's a place that organizes your stuff, because that's half the battle. So let's just make up some drugs, right? Or some prescriptions that he's on. So drug companies are really excited about statin drugs, because they want you to believe that you need this to lower your cholesterol, which is a complete and utter sham. But I digress. Let's add that on there, because we want to make sure the drug companies get their monthly recurring income from you until the day that you die. And if you disagree with me, then tell me why these statins haven't cured your high cholesterol. Well, we all know that drug companies are here to create customers, not cures. And now I'll probably be shot or something, because the truth, whenever the truth comes out, you get attacked by evil, right? Okay. So rosuvastatin, let's say, what else do they want everybody on? I mean, lisinopril, that's a real generic, low cost. Let's just say you're on 10, 1 a day. Okay. And pharmacy. Let's say you go to Walgreens, because it's first on the list. All right. Let's add another one just in case. Let's say CVS. Add pharmacy. Okay. Guess it only lets me do 1. No problem. Okay, so we got Walgreens, we got a couple medications. Let's start a quote in our hypothetical situation. Now, you can also do this quotes on your own. I know some of you are good at technology and you like to kind of figure things out on your own, that's how I like to do it. Okay, here's another place where the agent without the right core values can take advantage of you. So see on the left-hand side here, it says additional filters. Well, my appointed plans. That means these companies, some of them play nicely with brokers and agents and some do not. What we found out right before open enrollment started this past October, like the day before, is that, hey, we're not paying you anymore. So thanks, WellCare. So they set us up, right, to basically do all the work of helping you with your drug plan, but they don't want to pay us a dime to do that. No problem. Just understand, if you're hiring somebody to do a job and you're paying them zero, what kind of motivation do you think that person's going to have to really spend a lot of time and effort helping you out, right? So I get it. Some folks, you don't have, you have a real hard time making ends meet. And I get it. I do the financial planning and I'll say things to people like, hey, they'll go complain about their bills, right? Or how come I don't have enough money and blah, blah, blah. I say, well, okay, let's see, what expenses do you have? So that's part of what we do is we gather their income, gather their expenses, and help them sort of figure it out. Well, TV, TV, $150, $200 a month. I'm like, well, did you know you could put an antenna on your house and basically get free TV? Oh, well, we watched this show on Showtime and that show on that one and that. Okay, then be broke. You can't have it either way, right? Or both ways. So same deal here, right? So just keep it in mind and understand that's what's going on out there in the market. So in case you decide to talk to somebody else besides me, I'm equipping you to pull back the curtain so they can't snow you, right? So I'm going to uncheck my appointed plans and see how many. Okay, so there was only one, I think, that opened us up to. Yeah, it went from 11 to 12. But if I'm on the other side of this conversation, then I want to see every gosh darn plan, not just the ones you have or not just the ones who play nicely with you. So here we are. These are sorted by lowest total estimated cost. And this is Part D plans only. Okay, PDP, prescription drug plan. So I'm surprised that WellCare was able to eke out 3.5 stars. I give them more like a -2. But that's just because I've known them over time. Okay. Either way, commission 0 for me. So what do? Do I scroll down and go, oh, commission, and say, here's the best one for you, Bob? Okay, your total estimated cost would be $150. Not high. Could I get away with it? Sure. Do I want to? No. Because $150 is higher than 0. Estimated total cost. And if you're doing business with me, matter of fact, it's hard for me to do business with a lot of people because I have this amazing antenna for lying and bullshit. And I don't want to see it at all, right? So that's how I treat you. I'm not gonna lie to you to try to eke out what, $15 or $30 at these companies. It's just not right. So point is, this is the right plan for Bob in our scenario. Monthly plan is 0, premium, 0 per month. 0 per month. Why is it 0 per month? Well, because they used to pay us to help you, but now they took our commission and put it towards your premium. You're welcome. You see why some agents might want to go down here and say, well, wait a minute. Let me get paid at least if I'm going to help them out. See, I'm going to go to a whole new model where you pay me a fee, and I don't work with any of these companies. I just help you assess them, and you pay me directly. This way we cut them out, but that'll be coming soon. Anyway, WellCare Value Script is the right move if financially is low cost is what you're looking for. So let's look at the details. Drug cost is 0. Why? That's because from April to the end of the year, the copays are 0. Right? So there you go. That would be the right move. So what we would do in this hypothetical is we would find a supplement plan like ACE, okay, and you see I do have the discounts applied here, so that'll include a 7% discount. Now if Bob lives by himself, we take that off of here. Now 182 versus 169. So it pays to be married or live with somebody who's 60 years or older. That'll save you some money. So what I would do is I would help Bob apply for Medicare Part B if he didn't know how already. And all we do there is go to ssa.gov and click on Apply for Medicare. I have a little 6-minute video that shows you the exact steps as if I was doing it with you online. It's part of my Key to Medicare bundle, which has turning 65 checklists and handy guides, right? I made a PDF that it shows you what you need to know about Medicare without all the extra junk. Okay. And so there's different things in this bundle, but part of that bundle is here's how you apply for B. So what Bob would need to do is first, you got to figure out your stop date of current coverage, your retirement date, or maybe it's your turning 65 date. The point is you need to have a date first. Okay. So that we can say, all right, Medicare, we want you to start on this date. We want the supplement to start on this date. We want the drug plan to start on this date. And you would sign up for those things. And the way I do it is you don't pay anything for the supplement until the effective date. This way it makes it real simple to not be overcovered or double paying, at a close time in the calendar. So you apply for Medicare. While you're waiting for Medicare to come back and get your Medicare number, you can apply for the ACE Plan G supplement, and then you go and apply for your, it flipped over to MAPDs. Okay. Switch it back to drug plans. Okay. And you apply for your Part D. Now, on Part D, you do need to have your Medicare number in order to apply for Part D. We do not need your Medicare number to apply for your supplement. Okay, because what happens is everything is coordinated electronically. So even when you go to the doctor, you're going to take your Medicare card, your ACE card, and you're going to give them both to the person. Doctor's going to bill Medicare. Medicare's going to go, okay, let's see what's covered and what's not. They're going to kick the rest that isn't covered down to your supplement electronically. And so everything will coordinate based on your Social Security number until you get your Medicare number. Once you have your Medicare number, Medicare and the ACE insurance company are going to share that information. And now all the billing happens electronically. Okay, so here you are. So out of giggles, let's see what kind of mistake you could have made if you just went with what your friend had. Now, granted, there's only 2 meds. They're cheap, so it shouldn't make too much of a difference. But let's take a look at this estimated yearly cost number. Here you have 0, 150, 258. Let's go all the way to the bottom. So if you chose the wrong plan because maybe you met with a Humana agent, that an agent only represents Humana, do you think they're going to talk to you a whole lot about Aetna and Cigna and United Healthcare and WellCare's plans? Nope. You're going to see Humana only. Right? So Humana Premier RX, $1,168. So you could make a $1,200 mistake by choosing the wrong plan. You definitely do not want to do that. Right? Okay. Because what you should be paying is 0. That's a pretty good number to add to your Part B and your supplement. So $4,100, $4,200 is what you need to budget for that. Okay. Let's see. Let me go and find you my Medicare bundle real quick and show you what that looks like. All right. Key to Medicare bundle. All right. Let's pull this over. Okay. Man, there's a good looking guy over there, huh? Okay. So this is the bundle that I'm talking about. If you want to go directly to that place that I just was, that where with the quoting tool right here, and you want to mess around with that yourself, be my guest. What you're going to do is, contact me, and I'll text you the right. Actually, do it. Let's do it this way. Hang on. All right. So here you go. If you want this or are confused or about any of it, just give me a holler or call my number 443-543-9200 and tell Morgan, my AI assistant, who helps me while I'm creating videos and helping people like you, which is absolutely brilliant, by the way. If you're not using AI at this point, you're going to be used by AI pretty soon. It's really, really fun, but that's a whole different story. Okay, Key to Medicare bundle download. So here's what you get. Key to Medicare guide, PDF that you download, the new to Medicare checklist, right? And here they are. This is the page that I'll text to you or email you once you fill out this little form. Please send my Key to Medicare bundle. So you click on that and just stick your email in there. And I think I want your phone number. Look, I have no desire to bother you with nonsense, but I will tell you when I have an event, things like that. And don't worry, this isn't going anywhere. Okay, I just need a way to get you this stuff. So, okay, you put your email in there, and then I'll send you this page where you have access to it, right? So you can just download this Key to Medicare guide immediately. Check this out. I just updated this for 2025. I'm a little ahead of Medicare. Usually they send out the new Medicare documents the following year. But, government versus private. Okay. So here's a little about me. You can skip right past that. Here's what I just ran through with you. Parts A and B, supplements, Part C, things to consider. I just put a lot of pictures and put it in an easy-to-use format. Tells you a little bit about the skilled nursing. Because, here's how Medicare Part B works. Just plain English, big spacing, lots of pictures. Don't want to hurt your head. Okay. Medigap, also known as Medicare Supplements. There you go. All the same stuff I just told you. Here's some questions, answers, people raving about me. Sorry, can't help it. Click here to get started. Okay. So if you want to get an appointment, you just click that link right there, right smack in that guide, and it takes you right to the Medicare or financial planning appointment calendar, and then you can book an appointment right on the spot. You don't like technology, call the number, and it'll work that way too, 443-543-9200. Here on page 16 is a link to watch the little 6-minute video on exactly how to apply for Medicare Part B. Okay? And it shows you two ways. One, if you are turning 65, and two, if you are retiring and getting off of a work plan after age 65. Okay, so that's a real handy thing there. I would highly recommend you click on this YouTube link, okay, and then follow me, because I'm amped up to start putting out all kinds of educational videos. I just did a seminar on the basics of estate planning that you can watch. Looks like I put it on here twice accidentally. Either way, watch them. That's a great thing. Okay, here's my website. All right, and follow me on YouTube, Facebook, so on. So right inside that is that's your guide, your Key to Medicare guide. Also in there, you're going to have your checklists, coverage review kit, what you need to do at certain times, whether you're turning 65 or after 65. And then I'll give you a personal Medicare supplement comparison that I just did on this video, basically with a hypothetical person. I'll do the same thing for you. And there's zero beating you over the head with anything. I I believe that you will make the right choices when I educate you properly. Oh, and I get a lot of questions about annuities because, frankly, if you go on Facebook right now and look at some of these ads that are being placed, like Fisher Investments, it says, I forget what it says, Fisher, like, don't buy an annuity. Really, Fisher? Like, nobody ever should buy an annuity? Let me explain why Fisher doesn't want you to buy an annuity. And guess what? You already know the answer if you're a thinking person. Guess how much Fisher gets paid to sell annuities? Zero. Why? Because they're a fiduciary financial planner just like me with my other hat on. And you get these people that get all amped up on fee only, and, they won't touch insurance products. All right. I get it. But you know who that's about? Their ego. Why? Why is that about ego? Well, because it's more important for this person to pretend that they're somehow pure by saying, hey, I'm fee only. Like, I don't do commission based. I get that. And that makes sense when you're talking about investments, because the last thing you want is to have somebody putting investments into your portfolio based on how they're paid on them. Okay. You don't do that now, folks, right? Pay the person directly. Pay me directly a fee to put my interest in line with yours, right? And that's how it works. So if an annuity ends up being the right tool, well then, guess what? Perfect. You're going to get an annuity, right? But it is a tool like everything else, and you don't just go out and spray them to all the wrong people, all right? But I tell you all that to say, if you want to watch a little course without talking to anybody, the truth about annuities, there's a little mini video course I made here. Now, I can't take all the credit. The company I work for is fantastic. They put the basics of these videos together. I just put some nice lipstick on them, but they're only 2 or 3 minutes each, and it's really a good watch. Ooh, I put some nice music.
If I could show you a game to demonstrate how you
Check
can
it
have
out.
potential for growth in the market without risk of any loss, would you want to play?
Yes, I would.
I'm going to use $2
3 minutes. I know in our short attention span world, 3 minutes might feel like an eternity. But, you figure if each one of these is 3 minutes, you take a half hour, you're going to know everything you need to know about annuities so you can look cool at the kitchen table or the breakfast table with your friends when they say, oh, don't buy an annuity. I heard annuities are bad. I get it. I get the fear, but this is the facts here, right? And really, where else are you going to get a guaranteed lifetime income that you can't outlive? Okay? So if you want to just ignore all those tools and get your news from the TV, please don't call me. I am not a get your news from the TV person, and I'm only looking to bring on 1, maybe 2 clients every so often because I do a real deep dive, and frankly, most of you aren't really qualified to get there yet. Okay? So do yourself a favor. Educate yourself. Check out the courses. Check out this guide. Hopefully the Medicare education helped you. Getting a little thirsty. Need to get some calories in me here. So thank you for joining, and give me a call. I'll help you out. 443-543-9200. We'll just have a normal conversation and answer questions on Medicare and make sure you're not getting ripped off. And I will give you a ton of value in this bundle. And I have a bunch of other stuff too to give away. I just all about giving out value. So thank you for listening. Please hit the subscribe button. Please share this video with your friends. And let me know when you need help. Happy to do it.